the Secretary of State, that's Mr. Hancock, took the position that in this situation, he, rather than, say, the medical profession or the public, should ultimately decide who should live and who should die. And then you say, fortunately, of course, that dilemma never actually crystallised. Just before I ask you about this, to note that, is it right that the previous Secretary of State, or possibly a previous Secretary of State, but Jeremy Hunt, had taken a different view of this matter, had he not? I think it was connected to exercise Cygnus, which had happened some years before. He had taken the view, and this is in fact something that he spoke about in evidence in Module 1 of this inquiry, that decisions of this type ought to be reserved to clinical staff. Is that something you're aware of?
Yes, I've heard Jeremy Hunt say that, yes.
So there you are. I mean, he took one view, and you're saying in your statement that on the 12th of February, Mr. Hancock took a very different view. Did you have a view as to whether that was an appropriate line for him to take, desirable or not?
I thought it would be highly undesirable other than in the most extreme circumstances, and you can argue that these are the most extreme circumstances, and that is one of the reasons why the Department of Health and Social Care, I think, created a ethical and moral advisory panel to sort of ask the question. I certainly wanted to discourage the idea